We're joined now by a member of President-elect Joe Biden's new coronavirus advisory board. That's Dr. Michael Osterholm. He's an epidemiologist and director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Good to see you. Always good to have you here.
Good to see you again.
Let's start with this.
Thank you very much, Gail.
Yeah, I'm so glad you're here because now we've got not one but two drugs who are going for emergency use authorization. Why are you so encouraged by this? This sounds like great news.
It is great news. I think we have a light at the end of the tunnel, but we have to get to the end of the tunnel. And I think that's what is really sobering today is the challenges we have before we're going to see most Americans having access to this vaccine.
So here's a big question. Has Team Biden started talking to Team Trump? Because now we're going to have to figure out a way to coordinate all of this. Have those conversations began?
The transition team is, in fact, talking to the administration, to the senior leadership at the Department of Health and Human Services, and that's a really good thing.
Are you getting the information you need, Michael?
We are. We're getting information relative to, what's being done. I think the challenge is what is being done is not nearly enough. Right now, I have a major fear that although these vaccines will start to become more available over the next several months, many Americans won't take them because of the fear that there's some safety issues with the vaccine. We have done nothing to really reassure Americans what these vaccines are, what they will do, how they will work, and why they're so important.
What should we be doing?
Until we get that...
What should we be doing?
Right now, we need to...
Yeah, now's a good time to start with the reassurance, Michael. Now's a good time.
I'm happy to do that and tell you that these vaccines are going to make all the difference between dying from this virus and living and beating this virus. These vaccines are going to be very safe relative to any other vaccines we use out there. These vaccines are going to likely be quite effective, at least in the earliest days. And all the rumors that there's something unusual about the vaccines that make them dangerous are not true. They're rumors, and that's it. And we have to reassure people. I'd be the very first person in line to take this vaccine, but there are others who need it more than I do right now. And I think that's the message we have to get out. In the Black, Indigenous, and communities of color, we have a lot of distrust. As high as 75% of these populations don't believe this vaccine is safe. We have got to give them the information so that they themselves can judge why they want to take this vaccine.
If you've had COVID, do you still have to get a vaccine, Michael?
Yes, at this point, we're saying go ahead and get a vaccine again to make sure that you have adequate protection. We believe that a clinical case will give you good protection, but we want to be sure. So rather than try to distinguish who has and who hasn't had it, everyone will basically be in line for the vaccine according to what the recommendations will be forthcoming from the CDC tomorrow.
Michael, there are 100,000 people in the hospital right now. As Dr. Fauci said over the weekend, we're in the middle of a surge. He believes there will be a surge upon that surge. How bad do you think the next few weeks are going to be?
Well, it's at this point, Tony, where Alan, it's Anthony, really hard to say. I meant to say Anthony, thank you. It's hard to say in the sense that we look at where we're at, 200,000. Just 2 months ago, we were at 40,000. We could go much higher than 200,000. I think what happened during Thanksgiving is, in fact, a lot like a 100-mile-an-hour wind now coming into a very intense forest fire. And we don't have a clue yet. Could this go up another 50, 60,000 cases a day? It sure is possible. What I also worry about then is we're going to see the virus activity then slingshot into the Christmas holiday season. And we have many more people who are going to travel for that.
Michael, a lot of people, as you know, broke the rules. Now they're going back home to families. We hear different things about quarantining. Do you still have to quarantine for 14 days? What's the answer? And then we got to let you go, George. What's the answer?
Sure. No, not 14. At this point, I think if you say 10 days, maybe even 7 days, that will be more than adequate right now for what we need to do.
All right. Michael Osterholm, thank you very much for being with us this morning.